Today I'm talking about the dangers of taking benzodiazepine to treat anxiety disorders, panic disorder, and OCD. I'm Paige Pradko. Welcome to Therapy for a Better Life. Back in the 2000s, I was treating clients as I am today with general anxiety disorder, different anxiety disorders, panic disorder, OCD, depression, and I noticed I had this group of clients that no matter what I did, and believe me, I tried everything, were just not getting better. They were not making any progress at all. And I pulled their charts and I started really looking through their files to see what can explain this. Is it something that I need to be doing that I'm not doing? What is going on here? And it just kind of jumped out at me from their files that the clients that were not progressing were all taking benzodiazepines, different ones, but the same drug classification. The clients that were not taking benzodiazepines that had the same symptoms were all getting better, all making progress. So I started, of course, researching benzodiazepines. Everything I could read, everything I could find in the libraries, everything that I could find from the universities. And I found out a lot of information about benzodiazepines and what it does to the brain and all of the negative side effects and why it seems to shut down the brain, and clients with anxiety and OCD and panic disorder that are taking them are just not going to get better. I want to share some of that information with you today. Now, when I say benzodiazepines, I am talking about, these are some of the common generic drug names, and you can look them up. Alprazolam, lorazepam, clonazepam, and diazepam. Benzodiazepines became popular in the 1960s, and they were kind of seen as like almost this miracle drug. Tranquilizers that people were given for anxiety and insomnia and agitation and stress and muscle spasms, and they were given them for alcohol withdrawal and just about everything. The scripts were written so freely for these medications. We know that the benzos actually work on the nervous system. It tranquilizes, kind of suppresses the nervous system, and it works through in the limbic system where the fear center is, the amygdala, and also on the brain stem, and it enhances the effect of a neurotransmitter called GABA. Now I want to share a little bit now. If we move forward to 2019, I'm going to share a little bit of research with you on some of the negative effects of benzodiazepines. I'm going to share an article with you. Actually, this article is from 2015, and I don't know if you can see it very well, but I'm going to put a link to this article. It was in a medical journal, the Osteopathic Family Physician, in 2015, Volume 1. It's called The Current Role of Long-Term Benzodiazepines for the Treatment of Generalized Anxiety. The author, one of the authors, is Steve Louvette, and again, I will put a link in the description for this journal article. So benzodiazepines are one of the most widely used medications for the treatment of general anxiety. Although benzodiazepines have been beneficial and effective for short-term management of anxiety, when they say short-term, they are talking 2 to 4 weeks. Anything over 4 weeks is considered long-term. But they have not been shown to be effective in producing long-term improvement in anxiety. Chronic use of benzodiazepines has demonstrated multiple side effects, including cognitive impairment, decreased motor coordination, problems with concentration, social phobia, and depression. The development of tolerance, dependence, and withdrawal are some of the most significant problems associated with the long-term use of benzodiazepines. Withdrawal associated with the use of benzodiazepines includes insomnia, agitation, seizures, and coma. Now, to add to the list in this article, which has, they cite loads and loads of research, and so it's really a wonderful, very well summarized article on benzodiazepines. But I want to add to that with other research that I found. Catherine Pittman, I just want to kind of familiarize you with her book. It's called Rewire Your Anxious Brain. She wrote an earlier book to this that's not in publication anymore called Extinguishing Your Anxiety. And that's when I first became aware of her research. And she talks more about therapy and the consequences on therapy, which I'm going to get into also. But to add to the list of negative side effects of benzodiazepines, I want to point out a few more side effects that are pretty scary. I talked about the side effect of depression. Also, we see quite a large increased risk of suicide. A poor reaction time, slower speed of processing information in your brain, and verbal learning problems. Agoraphobia, the loss of sex drive, increased anxiety with long-term use, and difficulties in memory. So there is an organization called the National Institute for Health and Clinical Excellence. Now, according to their recommendation, benzodiazepines can be used in the acute setting of anxiety, but not longer than 2 to 4 weeks. That's what they're recommending for physicians. Now, from a therapy standpoint, I want to discuss with you about what are the effects when you go to therapy and you're on a benzodiazepine. I try to educate my clients when they come in because they are still being prescribed these medications, that being on a benzo really makes psychotherapy, any type of talk therapy, completely ineffective. I believe it has something to do with the memory problem of learning new information and being able to process it and put it from short-term into long-term memory. CBT, talk therapy, definitely going to be less effective if they're on a benzodiazepine. Exposure therapy, it is going to be completely ineffective because the brain is being numbed. In exposure therapy, we're trying to rewire the brain. We're trying to create new neural pathways so that a person can actually learn something new, that if in a panic situation, that they're not in danger, and their brain has to learn that through exposure. The same with OCD. And if you're on a benzodiazepine, you cannot create this new circuitry in the brain. If you have OCD, I have seen people with OCD, when they're put on a benzo, begin to compulse more compulsive behaviors. I believe this also has to do with memory issues. ECT, electroconvulsive therapy, again, not effective when a person is on a benzo. It has something to do with changing the seizure threshold. Now, this is not an anxiety disorder, but people that have PTSD, when they're giving a benzo, like a lot of soldiers were after the war, their brain kind of shuts down. Again, they're numbing it, but they stay stuck in their trauma. So the brain cannot process new information, that now they are safe, they are not in that environment anymore. So you really do not want to give a benzodiazepine to somebody who is in a trauma situation or has PTSD. And finally, substance abuse patients should not be given benzodiazepines. They're highly addictive, and hopefully this practice is discontinuing. So you might want to know, if there are all these negative consequences, all these negative side effects, really serious long-term side effects, and it's not helping anxiety at all long-term, why are physicians and psychiatrists still writing these scripts and giving people with anxiety and panic and OCD benzodiazepines? I have, some theories on this. First of all, I believe that physicians are trying to help their patients, and they're trying to, alleviate their worst symptoms. And so they're trying to take away the panic of a person with panic disorder. They don't understand they're making it worse. They don't understand that the patient is now going to have these worse symptoms, plus they're going to have panic, and they're not going to be able to really help themselves. The doctors don't understand that. They're not up to date on this particular research. And that's another problem, is that there really doesn't seem to be this vehicle for doctors other than on their own to review this research. Also, it's standard practice. And so if one physician is training another physician, and this is standard practice to give these medications, it's going to be years and years and years for this research to get out. Also, there is not a great line of communication back and forth between therapists and physicians. I continue to try to call my physicians, my patients' physicians, and try to have a communication about how my clients are doing, but it is difficult to really get that line of communication going. And finally, patients, many of them want these medications. They see them as their savior. They don't understand the long-term consequences. They don't understand that their anxiety will be worse. And when the patient really wants them, they're going to go to a physician that will give them to them. And so this is a problem too. Now, what can help a person with anxiety, panic, and OCD? Number one is psychotherapy. Psychotherapy has been proven to be very effective with these kind of disorders. There are some antidepressants that can help, and it depends on the person, it depends on the antidepressant, but the antidepressants combined with psychotherapy can be very effective. And finally, lifestyle changes. Exercise, sleep, nutrition, social support, all kinds of lifestyle changes can really help somebody with anxiety. So I would love to hear your comments. I would love to hear about your experience with benzodiazepines and any questions that you may have. I'm going to again leave you links to research in the description of this video. And I want to remind you to subscribe to my channel, because I try to touch on different topics in mental health that I really think will help people. So until next time, I will see you in session. Take care. Bye-bye.